Hello everybody, I'm Dr. Reed Lerman and this is Donna Zilber, a current patient of mine. And Donna came to me for some care, and we're going to talk about the care that she's had and why she came here and how she's doing now. Okay? So, hi Donna, how are you today?
Hi Dr. Reed, how are you?
I'm great. So tell me, why is it that you first started care with me?
I was in constant pain morning, noon, and night, and I was living on pain medication. I have 2 small children and a husband, and I didn't want to feel like I was being drugged just to get through a day.
So when you say constant pain medication, what kind of pain medication were you taking, if you don't mind?
I started out on hydrocodone. I was up to taking 2 pills every 6 hours, which would be 750, so that was like 1,500 milligrams of hydrocodone, and I was getting used to it. So they had recently put me on a pain patch that contained opium, and that would be a 24-hour, it would actually stay on for 3 days, and then it would be changed. And I did not want to live in constant medication and not be able to function properly and not be addicted to the medication.
How long were you on the pain medication for?
I've been on the hydrocodone for at least 3 to 5 years, and the pain patch they had just recently put me on it, and at that point I was like, I can't go on with this, not with medication and living that way.
Wow. And what were your pain? Where was it at?
My pain was from top to bottom. Mostly, I had a very bad neck. I could only go about this much, and at a yield sign I would have to twist my whole back, and then it would cause me the back pain and the neck pain. My back hurt right across the back, sometimes pain down my legs, even the front of my legs. It was horrible. It was absolutely horrible. I also suffer from carpal tunnel. I have a lot of pain in the thumb. I have a lot of arthritis and spinal stenosis and all kinds of things going on with my spine. But this carpal tunnel, they actually told me I was at the point of surgery on both my hands, and I do not want to go through another operation. I know people who have carpal tunnel surgery, half and half. They either like it or it didn't do anything. So I don't want to sit there and get cut open and have no use of my hands for a while to have it be worse than it is. And it was unbelievable. This pain, this thumb right here, caused me so much pain. If I was driving and the pain would hit, I would actually bite on my finger to make the bite feel worse than the pain inside. It was unbelievable. But I can say right now, I'm not feeling like that at all.
So were you pretty much in constant pain before?
Yes, I had a job where I was standing on my feet for 6 hours. I was fine while I was standing. When I went on lunch, I did not even have the option to sit, because the moment I sit down, everything would lock up on me, and then I would never be able to go back to work. I would stand on my feet for 6 hours. When I left my job and got in my car, I was like a cripple walking in my door. And then I spent the rest of my night in bed,
Wow.
literally in bed.
Now, are you still doing that same job?
No, I'm not doing that same job. I've left that job because of the problems I had, and now I do less on my feet, but I do have some bending, and but it's not as much as just standing on my feet for that amount of time now.
So now, how are you feeling now that you've had my care?
I am off pain medication 100%. I don't need the patch. I don't need the hydrocodone. And most of the time, I say most of the time, I don't need even the muscle relaxer. Sometimes I have to take the muscle relaxer because I'll get like a twinge in a muscle area or something from something I did that day. But other than that, the pain in my spine, I feel like I'm nearly pain-free. My thumb barely hurts. The only thing I have is the numbness. It's a little still, but we're working on that, and I'm feeling a little better with that. I actually am not dropping as much. So there, I can say either, we're controlling it better.
We didn't really start working on your wrist till like this week. I primarily was focusing on your spine.
It was unbelievable how quick everything happened.
Yeah.
In less than a month, I'm off the pain medicine. And I'm moving like I could turn my neck. I have like 100% better rotation in my neck, probably like a normal person now.
Now, when you were driving, would you notice that with turning your head?
Oh, I noticed that right away. I mean, I could only go this far, and then I had to go this way, and I still couldn't see. So when that yield sign, I was taking my chances, because I really did not have a clear view. But now, I can see all the way back there.
You can turn your head.
It's amazing. It's totally amazing, and I don't have to use my back to turn either. It's my whole neck. It's wonderful.
That is wonderful. Let's talk a little bit about the care that I've done for you, because it's not traditional care that people would seek normally from a chiropractor. And we're talking about the laser therapy. Tell everybody, I use a class 4 laser. It's called a K laser. It's a deep tissue laser, and it's very penetrating, and it reduces inflammation and stimulates tissue healing. So let's talk about your experience with the K laser and what the treatments were like for you.
The treatment was pain-free for treatment. All you did was put it on the areas that were affected, and it would feel a little warm, and it actually felt good. And I would have when we started, I almost had immediate relief. It was like amazing, and you don't feel anything at all during the laser treatment except a little bit of warmth, and you go everywhere where I have the problems, and it's been completely amazing. It's like a miracle. Definitely like a miracle to me, because nothing would relieve my pain.
So they're gentle, they feel good, and the pain goes away pretty much immediately.
Yes, definitely.
Yeah. And then, how about as far as it lasted? Did you find each time the pain-free periods would last longer?
Oh, yeah, definitely. I
Yeah.
barely had any pain in this thumb, and I would have it sometimes 2-3 times a day. And now I barely have any at all. My back, it's very minimal, if any. Some days it's like maybe minimal, but I have arthritis. So on rainy days I may feel still a little twinge here and there, but not pain. I wouldn't even call it pain.
Yeah.
It's amazing. Totally.
Excellent. So is there anything you, off the top of your head, that you'd want to share with anybody else who's considering care or suffering in pain about what we've done?
I would say put 100% trust in Dr. Reed, because he is an amazing man. The therapies that you did on me were a total miracle, and very, very quick. We've only been here for about a month or so, and I feel like a completely a different person.
Less than a month.
It is amazing, yes.
Excellent. Well, thank you. It's been a pleasure.
Welcome.
I'm glad you're doing better.
And I look forward to my visits, because I know I'm only getting even that much better.
Yeah.
Thank you. I really appreciate it.
My pleasure. Thank you.